What's up and good morning everybody, this is Paul. We're here with another episode with the most commonly asked pre-PA questions. Happy Sunday, I hope you guys are going to enjoy this video, so let's go ahead and start with the intro. Well, hello and welcome, or welcome back if you're a returning viewer. I'm super excited to have you guys here today, and I just wanted to remind you, if this is your first time, what our channel is about, we're answering a lot of the commonly asked pre-PA questions and hope to help you or other pre-PA students when they're applying to school. If that's something that you would like to follow, please don't forget to subscribe, hit the ring button so that you get notifications when they're posted. Alright, so the first question I have here is, did your volunteer also include helping out in the community? Absolutely, this is correct. So volunteering for PA school is not just limited to medical volunteer. Myself, I did some medical volunteer, but I also did volunteer at church. I helped out with a few breast cancer campaigns, philanthropy events. I helped out with San Bernardino forestry a few times during my undergrad. So it's all about helping people, and that's what it ultimately is, and that's the ultimate goal, is to see if you are a person that likes to give back, that likes to help people, because our profession is in the service profession. We serve the community. We're serving those patients. It's important to see that you have those personality traits that you want to help others, and it's not just going to be in the medical field, but it can be in any field, in my opinion. This next question is amazing, and I think it's going to be really interesting to see what Aubrie has to say about it too, since both of us were kinesiology majors. So this person is asking, was kinesiology major a great major for you? Absolutely. It was a life-changing experience for me. I am so happy I changed my major to kinesiology. I was a biology major at first. I took one kinesiology class. It changed my life. I changed my major, and I graduated with a kinesiology degree. So let me elaborate more on that. Let me give you a little bit of background about myself. So I was in polo and swim in high school, my senior year, and I was in pretty good shape. I was, practicing and working out daily. And then I got accepted into Cal State San Bernardino, and that's where I went for undergrad. But once I started college, I stopped working out. I was just so immersed in studying and working, and didn't give myself the time to work out. I went from 160 pounds to 280 pounds, give or take, in 2 years. I just kept eating, gaining weight, not sleeping well because of work. I was working, 30 hours a week or so. So it was stressful. It was putting a lot of stress and toll on my body. I switched my major to kinesiology on my third year of undergrad, and I started taking all kinesiology classes. And it changed my life. It did. Motivated me to start losing the weight, because that's what I was studying. I was studying exercise and how to put a diet plan, or how to, put a good nutritional plan for someone, how to put an exercise plan for someone, what are the body's biomechanics, the, anatomy and physiology of the body, history of kinesiology. That had a big impact on me. So a lot of stuff it did. It changed a lot of my perspective. A lot of the classes we had to do a lot of physical activity, so it motivated me to do better, because I would try to do the physical activity and I would pretty much suck at it. But it motivated me, and that's what I took from my studies as a kinesiology major. Did it really help as a PA student? The anatomy did help a little bit, but as a bio major, you'll take anatomy, and it's part of the requirements. But I feel like it kind of prepared me in a way, and I don't regret it. I would definitely, if I were to go back, I would definitely become a kinesiology major all over again. And I highly recommend it. It's not just for PA school, but for your personal growth. I think it's going to change a lot of perspective, and it's going to change a lot of the mentality that you have as a person. That's just what I took from it. Well, let's go ahead and see what Aubrie has to say about that one. Both of us were kinesiology majors, but we went to completely different schools, so I'd love to actually hear her opinion on that.
So next question is, was kinesiology a great major choice for you? And overall, my answer is yes. So I started out as a biology major, and once I looked at the courses that I would have to take, I just wasn't as interested in them as much as when I looked at the kinesiology courses. So kinesiology at my school was pre-physical therapy, so it was geared towards people who wanted to go into grad school for patient care. Although PT and PA are extremely different in terms of what they actually do, they still both have the common goal of treating patients and providing quality healthcare. So at the end of the day, the information I learned from my pre-PT classes are very applicable to the whole PA profession. So the major in my school was more hands-on since it was geared towards a more clinical role. We had more classes that revolved around building rapport with patients and learning how to be a good clinician and building skills with the communication and making sure your patients trust you. So I think that aspect of my major was extremely helpful. And I didn't really see that information in any of the science majors such as biology. By all means, that's not a diss to biology. That's just something I wanted in my education. I wanted to get that kind of experience before I started PA school. So I decided that since my school had a major that had that already included, I figured why not do that. My campus also had a physical therapy clinic on it, so it was for individuals who were low income, underserved populations with neuromuscular disabilities. So I was able to volunteer there, and then that was also one of our required courses. So even by my school offering that type of clinic as a class where you're required to take that was just such a telltale sign for me that kinesiology was the right path for me because it just had more clinical aspects to it.
What was the hardest or most stressful part about your PA journey? So I think there was two parts that were kind of stressful and hard. The first one was after I applied and I was just waiting to hear back. That was definitely one of my hardest parts. And the reason is I'm an anxious person when it comes to the unknowns. I like to always be a step ahead. I like to always be prepared. So the fact that I didn't know if I'm getting an interview or I didn't know if I'm getting accepted, that always gave me an anxiety. So that was one of the hardest parts. And the way I dealt with it, which I kind of talked about in one of the previous videos, but exercise. I just, I did the best I can do. I submitted all my applications. I made sure everything is on fleek, as they say. And I just went to the gym and started working out and just tried to take it off my mind. I mean, it was hard to take it off my mind, but believe it or not, some days I had, I stopped thinking about it and I was just living my life. So I highly recommend doing something to take your mind off of it once you've submit your applications and there's nothing that you can physically do to change anything. The second part was when I was actually starting PA school. So the first semester of PA school, everybody's like, oh, it's like a fire hydrant that you're trying to drink out of and all that kind of stuff. Yes, it is. A lot of people were stressed out during PA school. A lot of people had a lot of rough time during PA school. I had a rough time during PA school, but you learn to adapt and to use the situation for your benefit. So I think it all came down to time management and triaging things that you have to do. I kind of talked about that before, but there's going to be a lot of material and a lot of topics that you have to study. And you have to triage which topics are more important and which topics are more essential. But also you have to triage which part of the material in that topic is more important and which part is more essential. That you need to take care of. It's going to be a learning curve. You're going to acquire that as you're studying. What I recommend you do before you start school, though, is develop good study habits. My study habits for undergrad were crap, but PA school taught me it's a grad program. You need to study, and I had to study. So develop good study habits. Start learning your equipment. So if you're using an iPad, start playing with it. Just checking everything out, making sure that you're familiar with all the settings so that you're not learning your iPad at the same time you're trying to take the notes and stuff like that. So whatever you can figure out right now is figure it out now, because once you start school, there's going to be a lot of figuring out to do, and there's going to be a lot of stress, especially the first couple of months. This question is also a good question. They're asking, what's the difference between shadowing hours and patient care hours? So the difference between shadowing hours and patient care hours is pretty big, and they're both beneficial, and I recommend doing both. So shadowing hours is something like you will go to shadow a physician or a physician assistant or a nurse practitioner, and what you're doing is you're walking with them as they're seeing the patients, you're watching them as they're doing everything, and then you go back with them as they're typing their note, and you kind of probably discuss, this patient has this and this and this, that's why I'm doing this, and it kind of gives you more of a one-on-one with that provider. And you actually get to see the whole procedure. So if they're doing like a lumbar puncture, or they're doing, whatever they're doing, you're standing there for the whole procedure, you're watching the whole thing, and you're learning from it. So that's why it's beneficial to do shadowing. But patient care experience is a little bit different. Patient care experience is you're actually doing hands-on patient care experience. You're physically doing something with the patient. You're not just watching. Most of those positions are not volunteer, they're mostly paid. So when you're doing a paid thing, or when you have duties that you need to do, you might not be able to stick around for the whole procedure. You might not be able to go and talk to the doctor about why they're doing this or why they're not doing that after they're doing the procedure, especially if you're working and you can't just ignore the rest of the job duties. For example, for me, I was working as an ER tech. One of the PAs, he was a radiology tech before he went to PA school. He was also one of my mentors. I always tried to learn from him while we were in the ER and while I was working, but it really got difficult. I could not maintain having my job duties done and also learning from him as much as I could. So I actually decided to come in a couple extra days that I was not working, just as a shadow, just to shadow what he's doing, just to talk to him more, just to learn from him more. So I highly recommend both, and they're both really important.
So this last question is a pretty popular one, and that is the difference between medical model and the nursing model. So as I'm sure you know, PAs are trained under the medical model, such as doctors, whereas nurse practitioners are trained under the nursing model. So the medical model focuses more on cause and effect. So they identify the cause of the problem, the issue that they're presenting with, and the effect that it has on the human body, and how they can treat it. So it's more figuring out the problem, diagnosing the patient, and then figuring out what treatment will be best for that patient. So it's usually more science-based. So it's more of finding the issues, diagnosing the patient, getting the treatment, those types of things. Whereas in the nursing model, they're taught to look at the patient as a whole. Obviously, nurse practitioners bring in science. They have to diagnose patients and treat patients too. But the nursing model teaches students to look at more external factors such as psychosocial factors and other things that may influence the symptoms of that person. However, as technology and medicine progresses, the medical model and the nursing model have kind of blended a little bit together a little bit more. So when I work with PAs, NPs, and doctors, I really don't see a difference in terms of how the medical model or nursing model has influenced their practicing. So although the NP that I work with was trained with that, I see the PA that I work with doing similar things. They ask about all external factors that may influence how the person's feeling or how their symptoms are progressing. So just because a doctor and PA are taught under the medical model doesn't mean that they don't look at external factors too. I personally like the idea of training under the medical model. I know the external factors are extremely important, but I feel like I've gotten a good grasp on how to take in those external factors through my patient care experiences. Obviously, nurses know so much more, and they know so many external factors and how they can influence certain diseases. I don't have any of that knowledge, so don't get me wrong, I'm not trying to say that. But my patient care experiences have allowed me to have that in the back of my mind, so that's something that I'm always thinking about, especially as a scribe. When I hear people talking about things, in the back of my mind I have ideas running through my head oh, maybe it could be this, maybe it could be that, and I have those external factors in my mind. So I think that although I won't be trained under the nursing model, I'll still have those ideas in my mind when I'm practicing as a PA.
Alright, so that is it for today. I hope you guys enjoyed it. Like I said, if it's something that you like, if it's something that you're enjoying and you're appreciating, don't forget to give us a thumbs up, subscribe, hit the ring button so that you don't miss the next videos. Share it with your friends. I would highly appreciate that so that we can reach more people and so that we can help more people as well. All right, stay tuned.